fantastic presentation and panel. Sara will also be leading a panel now to talk even further about what digital health is doing in terms of solving these issues around diversity, equity, and inclusion, but now looking at chronic pain management, at-home management for folks in that category. And joining her today are two extraordinary leaders in this area, Shawn Smith from One True Health and Syed Arfeen from Hospital for Special Surgery. They are still getting mic'd up. So on that note, one of the things that we're also doing is we're taking questions online. So either going through the Zoom chat that is enabled with people around the world watching this. By the way, we're the only digital health meeting that is hybrid, live streamed around the world for free. So people are able to watch this and see all of our sessions for free using Zoom and linking in there. And they will also be available on our YouTube channel. So be sure to subscribe to HITLAB on YouTube to see whenever these sessions are being dropped, which will come out over the next 2 weeks, also for free. And stay tuned on those as well. So next up, Sara, Ziggy, and Shawn.
Awesome. Thanks. Before we start, I'm going to ask, I forgot to bring my phone with me. Hey, Jerry, can I have the 5-minute warning? Thank you. Great. So thank you, everyone, for sticking with us. I'm thankful to be here with Shawn Smith and Dr. Syed Arfeen. And I'd love to, just start with some quick introductions for our audience.
Thanks. Hello, everyone. I'm currently Vice President of Strategy and Operations at Hospital of Special Surgery, or HSS, particularly an innovation unit called HSS Health. Prior background as an attending physician, and then worked in management consulting, venture capital, and a startup.
And my name is Shawn Smith. I'm with One True Health. We're a family of companies based out of Austin, Texas. Our care management company provides virtual first preventative care primarily for Medicare eligible seniors suffering from chronic and acute conditions. And we have a technology company that's focused on a personal health record and a patient engagement platform to give seniors actionable insights on what they can do to get healthy and to stay healthy.
Awesome. Great. Thanks. So let's dive right in. So as Dan mentioned, today we're going to be sort of talking about how to better solve for these, for the issue of sort of ongoing chronic disease care, as well as acute care. And so my first question, Shawn, I'll start with you. As we know, our population's aging pretty soon. By end of decade, we're going to have a lot more of boomers entering into Medicare. I'm following close behind. And so, what do you see as some of the biggest challenges for health systems as, we get this population, this larger proportion of the population who are suffering from chronic disease?
Well, it's a huge problem. It's already $3 trillion is spent on managing chronic and acute conditions, from diabetes to hypertension to heart disease. And 43 million seniors suffer from 2 or more chronic conditions. So there certainly is the lion's share of that issue is coming from the senior population. And as you're right, the boomers are headed towards being all Medicare eligible. The biggest challenges, though, really have happened during COVID. And that's the challenges of clinical staffing and patient engagement. So let's take one of them individually, or take them individually. Clinical staffing, everyone heard about the Great Resignation, right? We've had a lot of nurses that have left, didn't want to garb up and be in the hospital system. There's certainly a serious issue in rural communities, especially. They got hit hard with respect to the Great Resignation. They're having a hard time doing transitional care management, case management, loss of nurses. It's really important for rural communities to keep patients within their catchment area, and they're having difficulty doing that. So clinical staffing really exacerbated that problem. They can't follow patients home to help assist them with their chronic and acute conditions. Second is only 40% of American seniors actually saw a doctor in person or through telehealth during the pandemic. So now you have a problem of engagement. These same clinical practices are trying to reacquire their patient, if you will, and to bring them back without it being hair on fire into the emergency department. So how do you go engage that population that's been out of the healthcare system? help them to manage their chronic and acute conditions so they don't go hair on fire to the emergency department, and then bring them back in appropriately into the health system for revenue generating encounters from clinical practices to hospitals. So I would say clinical staffing and patient engagement are the two biggest challenges as we go post-pandemic to manage chronic and acute conditions.
Thanks. No, I hear you, and I hear, that staffing issue all the time now, and I've seen some really interesting solutions coming out around that. I'm curious, Ziggy, are you seeing the same thing in terms of HSS and more broadly?
Yes, I think certainly those are true. As I think about particularly chronic conditions, but chronic and acute conditions and that aging, increased burden, I suppose I always think about the 4 levers of viewing healthcare through cost, quality, experience, and access. And really on all of those accounts, you have increased pressures. Cost is either staffing, inflation, maybe the supplies, as we've heard earlier. Quality, people always want better and better quality. It's a competitive market too within that. There's also then the experience. In a way, the big tech spoil us with having good experiences, so we want those also, understandably, with healthcare, with that. And so with the pressures on those, but the good thing is, and I suppose we're here, is technology is kind of the answer on all those levers. You can apply technology on all of that: cost, quality, experience, and access. But the challenge, I guess, I've seen within healthcare systems, and it's not unique to HSS at all, not even unique to the United States, actually, with that, is the industry itself is busy with day-to-day operations, which are high risk. It's risk averse naturally. Coming from the pharma side of the 30-year evidence that you have to adopt any technology, and it's often human capital focused too, either thinking about doctors and nurses or thinking about the patients. And so effectively, I suppose I think about the question of how quickly can the health systems adopt technology is where you could then solve the staffing problem, solve the engagement problem as well.
Right, so there's that last mile of, how do we get the evidence? What level of evidence do we need? How fast can we get you the evidence?
Yes, because ultimately, I suppose within a healthcare system, it's driven by providers, and providers, will come with their lens, how they're trained.
Sure. Great, thanks. Super interesting. So, Shawn, I'm going to come back to you for a second because you mentioned One True Health is building a personal health record. Would love to hear a little bit about that and why, sort of, what gap is that filling in this puzzle we've been talking about?
Well, it's just been something that's been big on our heart is, again, patient engagement, and how do you find ways using technology to really capture the interest of patients and give them the information, the actual insights they need to get healthy and to stay healthy. And, I find it interesting. I'm company's based in Austin, Texas. Here I am in New York. If I were to go to an ATM on the street, I would get a pretty decent picture of my financial health. But if I get hit by a bus on the street, that emergency department physician will have absolutely no information on me, my, medication contraindications, how to take care of me. And why is that in today's digital age? So how do we, it's not really a regulatory issue anymore. The 21st Century Cures Act has provided the ability for me as a patient through consent to go get electronic copies out of all electronic health records all across the nation. But what do I do with it? EHRs are designed for practitioners to deliver care appropriately to the patient. That's what they're designed for. They may have a patient portal, but they're not really meant. They're very localized. So, if I get seen here in New York, then that information is not going to go back to Austin, Texas with me. So, I have the ability of getting it, but when I get it, it's going to be a copy of something I don't understand as a patient. So how do we create a personal health record that has all the retrospective data without the inaccuracies, without the duplications, with data extracted to provide clinical meaning to me of what's happened retrospectively, add in remote patient monitoring devices, wearables, social determinants of health information. How do I get a real, complete, vetted, actionable picture of who I am and my health? And then the insights on what I can do to get healthy and to stay healthy, which no traditional EHR provides today either, right? So how do I take that care plan? You see seniors walking out the door with the stacks of instructions that they don't read and they don't understand, right? How do we solve those two problems? And that's what we're working on at One True Health.
Oh, that's really interesting too. I've heard this idea of a personal health record, but a little more dry than you're describing. Like you're really talking about, much as we talk about decision support for clinicians, kind of decision support for patients.
No, absolutely. And not in decision support, but really something that I could say, this is mine. And why can't I share it now electronically if I get hit by the bus with the emergency department physician? Here's what happened to me in Utah and in Texas and in Georgia. Give you more information to deliver care to me, but also again, those actionable insights, because as you know, I'm in that sandwich generation, 9% of adult Americans, a 82-year-old dad. I've got a son in college, right? And what I wouldn't do to make sure that I knew if my dad's taking his medications, did he walk today? How's he doing with respect to his sleep apnea and with his other issues? So I think for caregivers, for family members, they want to be involved. They want to help with the care. They want to help their aging senior parents. So I'd love to do that. But again, it comes to information that's available, understandable, and actionable. How do we do that?
Well, no, Shawn, you just take me back to some frontline memories where, I can think of, patient with a huge scar down the front, and you say, oh, what operation was it? I don't remember. I was in hospital for a month. And then you're dealing with an abdominal pain. Of course, that's going to have an impact. Or, I take 5 medications. Well, which ones? Well, there's a pink one, there's a white one, there's a big brown one. Understandable. And then spending an hour sometimes on the phone trying to figure out who. I suppose just to add to that, I find this first of all, I think it's great what you're doing, and I think really needed. Already could have happened yesterday, ideally. So while you work on the hard part, just to add a bit of thought, I see it somewhat as changing a bit of the social contract between patients and the provider. So often the provider would have had the information, would have had all the data, and then power lies with whoever has the information. And so while the provider had the power and some responsibility, ultimately still the patient, and we've all been there, is left actually with the operational practice of navigating their journey, but without really the tools to help them do that. So I feel that, Shawn, as you solve that and maybe other companies do and adopt it, is that with a patient, and we're all patients, get to have your own record. I can think of already like 3 things that would improve. I think you'd immediately get better educated once next to your name you have this condition. Then it's visceral, and now you've got information search tools. That's one. Or in the case of, again, as HSS, we're now providing patients more information digitally. You've got better coordination to what you say, whether you're traveling from Texas to New York across systems. You just don't need to remember what those 5 pills are or which operation you had. But the doctors and the providers can manage that. And I think with that also is this some level of transparency and quality, going back to those 4 aspects. I just know as a provider, when I know a patient's reading it, you're just automatically doubly careful about what word you say or how you put it, or if it's a chance to share more information. So I think there's a lot to be gained from that personal health record being real. And then if you add all the things that you say, social determinants, genetics, wow.
Very good. All right. So we have the vision. Everybody get to work. Ziggy, I would love if you could talk for a little bit about, we prior to this, were talking about digital therapeutics in terms of, we see more and more out there for managing chronic conditions. But what about acute conditions, and should we start thinking about digital therapeutics more, in acute situations? Is there compatibility there? Is there opportunity there? I'd love to hear your thoughts.
Yeah, thanks, Sara. I guess short answer is yes, but the longer answer is there's a reason why I think chronic conditions get more than acute. Having more time to be there, staying longer, they are the lion's share the burden of costs, so that naturally attracts interest. But also I think there's a fundamental business challenge with an acute care versus a chronic care condition, because acute is often a one-off. It's not, you're going to get typically subscriptions, repeat loyalty, engagement to that aspect. And so it's harder to make, and then a smaller market to make that business case. I think also thinking back again to cost, quality, access, and experience, when you're in an acute situation, let's say you've injured your leg, you're more likely to say, I'm just going to pay what it takes. I don't care how much pain there is because I'm already in pain. If I have to wait 3 hours, I'll wait 3 hours. And so again, just harder to make a business case around it. Having said all that, HSS has created a business for it, which is just announced 2 months ago, and we were supported by $20 million of venture capital investment, and it's called Right Move Health, or Right Move Health powered by HSS. And this is for musculoskeletal injuries. It's a virtual physical therapy triage and treatment platform. So while there's existing companies out there where you can get your exercises either sent to you on videos and do it, this is really thinking about, again, all those 4 levels of cost, quality, experience, and access in saying you can it's a B2B business where you'd immediately, employee can call a physical therapist at will, same time, have a live person triage them, and then be able to say where they can be directed to. Because if you think without that, your current options are, you might go straight to an orthopedic surgeon, then you enter into an MRI, maybe an operation, maybe not, maybe a repeated appointment, an emergency room, it's going to be high cost, long wait, your primary care physician, if you can get in, how that is, a PT, which you're not sure if you really need or not. And then of course you figure things out at home. So you immediately get that PT level advice that can then, if you truly need emergency room, primary care physician, orthopedics, put you there. But if you need PT, you're immediately funneled through to have live one-on-one sessions, which you can arrange. And of course, you've got the digital technology solution where you've got your information, your education, ability to schedule, and then have those live sessions with more feedback. It's more engaging, thinking of the engagement aspect, and go through sessions to hopefully then lead you to a better outcome. You know, it's more cost efficient and a nicer experience. So I think it can be done. We're certainly working on that and happy to talk about that afterwards with anyone there is, but it is challenging compared to the chronic conditions.
I can see this applying to cardiac rehab. You can see it applying in a lot of other areas other than musculoskeletal. It's exciting. I think you're finding a solution again to what we talked about with the staffing problem, right? You're using technology, you're using triage to help make the right decisions because there just isn't in the old pre-pandemic way of doing it, a way of doing the right triage and informing the patient with the right therapy and the right course of action. So I'm very excited for HSS and what you're doing and that leadership.
Well, thank you. And to say, you know, just as far as putting some more specifics on the cost, that's a $380 billion market. You think depending, you know, what you believe, a quarter up to a half sometimes of surgeries could have been avoided for a plethora of reasons. You can imagine the costs that puts in. To the quality aspect, at HSS, we've been voted by US News the #1 orthopedic provider for the last 13 years. We've got a 160-year history and more than 100-year PT department. We can now give that out to rural areas through the virtual, who may not have access to a PT, let alone one that's, if you like, we might say HSS, you know, trained level. So it gives you that aspect, the experience of having it immediately, you know, and then access. That's something you can always try and get out there, but by going through large employers, hopefully that gets out into millions of hands.
Yeah, what you said, Ziggy, really resonates with me in terms of, you know, historically we've expected patients to sort of maneuver a system without knowledge or tools. Well, I actually broke my leg this summer. It was like, I didn't know what to do. I never broke my leg before. Where do you go? And what level? I didn't know it was broken. I went around for a month, so being able to give patients the tools then to maneuver a system, more effectively.
And you might have Shawn's personal record if you.
Could be like.
Sounds like a good combination.
It's great. All right. Looks like we have used our time. Thank you both so much. Really enjoyed the conversation.
Thank you.
Thank you, sir.